Dr. Seema Sharma, founder director of Srishti Femcare, and today through this video I will be telling you about what is the best way of taking an iron supplement. Well, a lot of pregnant patients are advised to take multiple supplements, and iron is one of them. And usually there is a lot of doubt about how should we take it with food, should I take it with water, milk, what time of the day should I eat this before that or that before. So, medically speaking, iron gets absorbed best in the body if you take it before meals. The reason is if you take it with meals, the absorption due to acid would reduce. And then there are certain things, certain food components which like phytates etc., which can reduce the absorption of iron. You need not go into the details, but best is to just stick to the advice that you take an iron supplement before meals. Second thing is, ideally if you can take it with a nimbu pani or an orange juice, or maybe have an orange along with that. That means any source of vitamin C along with your iron tablet, it will increase the absorption and you will get the maximum benefit out of it. You should not be taking it with milk or tea or coffee. The reason is that these liquids have certain compounds which can reduce the absorption of iron. Similarly, if you are on antacids like for regular acidity, you should at least give an hour-long gap between taking your last antacid with your iron tablet. And also again, if you are taking calcium supplements or certain other supplements, calcium is a common one, that's why I'm naming it. So you should at least have a 4-hour gap between iron and calcium supplements, because the calcium can reduce the absorption of iron, which is commonly available. The second question, a lot of people ask me, should I have it in the morning or evening? Well, that answer is that depends on you. As long as you can take the iron supplements on an empty stomach condition, you can have it either in the morning or evening. A lot of people prefer to have an iron tablet in the morning before their breakfast and then move on through their day. The reason is if they have GI discomfort or they have pain in the tummy because of iron supplement, then they can't sleep. So best is, while you're moving, you should just have that supplement. Another common thing people have with iron supplements is that, it does cause constipation in a lot of people. People complain that their stools have turned brown or dark or black, which is entirely normal. This is the body's way of getting rid of an extra iron. So don't worry about it. But yes, when you begin, first time when you are taking an iron supplement, I recommend that you take slightly a smaller pack, maybe take 4 to 5 tablets on a trial basis. Take one tablet maybe every alternate day initially, and if you're feeling comfortable, you have no constipation, you have no stomach ache, you don't feel quasi after taking an iron supplement, you can adopt that and continue to take that brand. But if that particular doesn't suit you, you can at least switch to another one, and that packet will at least not go waste. So that's my advice, just to start small packings and start small, maybe alternate day, and then switch to an everyday and a regular rhythm and take it on an empty stomach. And when a lot of women also have normal hemoglobin, especially in my practice, I see people are coming from good backgrounds, they don't have anemia, but because they have heard it from everybody else that my friend is taking an iron supplement, so why are you not prescribing me an iron supplement? I want to just give you a word of caution that iron supplements should be taken very cautiously and judiciously, because a person who has a hemoglobin of 14 does not require an iron supplement whatsoever. So just because your friend has been prescribed and it's become a fashion that some kind of supplements would be given in pregnancy, doesn't mean that you need it, because too much of iron, now there is research which says that too much of iron can cause paradoxical side effects, and it can cause smaller babies, it can cause growth restriction, and it can cause problems in your liver and kidney. So iron is a prescribed medication, so please take it only under supervision and do not continue to take on and on just because you are not feeling so good and you feel you have low energy, so you should be popping some iron supplements. Please don't do that. So take it only under prescription, only when your doctor has advised you, and take it for that particular moment. As soon as your hemoglobin or your requirement is over, please stop. Thank you. That's all for today.